All right. Hello, hello. Hello, everyone. Not sure who's out there yet. It's uh, it's a new technical setup for me today, so I'm going to give us just a minute or two for people to join us. Only only started the stream with about 30 seconds to go, so a little bit slow today. Waiting to see if anybody joins on Instagram because I can see that from here. Not sure how to tell who's joined from other channels, but perhaps they'll just stay. So let's go ahead and get started for the day. Um, hello everyone. If you're watching me on if you're watching me on LinkedIn or YouTube, this is the first time that I've gone live on those platforms. I'm using a new provider, if you will, and it allows me to stream to more than one place at a time. Very exciting. I tried it out earlier in the day, so hopefully I don't run into a technical hiccup. For those of you who don't know me, or perhaps for those of you on LinkedIn who I haven't spoken with in a long time, Rod Gamble, and I'm a digital health kind of guy. I'm a registered nurse. I'm a computer scientist. I've got 25 years of experience in digital health. My little digital health career has taken me all over the world. I did the math. It took me around the world 25 times, actually. That was, of course, pre-COVID, when everyone traveled for everything constantly for no reason. But now I'm able to stay home and work like this for most of my client interactions and support people from wherever I happen to be to wherever they happen to be. It's a really great time to be in digital health. Hello, T Serene. I see you over on Instagram. Thank you very much. I think these lives will also be retained over on YouTube and LinkedIn. So if you haven't checked me out on those other places, you'll see I'm pretty much the same guy. Might be getting better at some of the platforms than others, but we'll see how that goes. So what I do is I help clinical people move into digital health roles. All the clinical people have the same sort of concerns, like they know their clinical job, but they're not computer people. That was the sort of thinking that got me to get that master's in computer science that I mentioned earlier, which I have never needed in digital health. The whole time it's just been clinical work, clinical stuff. People want to talk to me because I'm clinical. So tonight we're going to be talking about multiple income streams inside of digital health, and some of the AI stuff that's been happening in digital health over this last week, because the AI stuff is both exciting and kind of terrifying. So. Um, the three things that happened this week, they really create what I think is a target-rich environment for people like us. Um, it's a fast changing, almost kind of wild west environment. And one of the big things that came out was Trump's new AI action plan. And whatever you think of Trump, whatever you think of his action plan, what's happening is we're entering into a AI first, regulations later kind of scenario, which is great for AI innovation, but we're interested in healthcare. We're talking about people's lives here. So that's kind of the regulations don't really support the seriousness of the kind of jobs that we do. And this week, a new AI powered primary care launched. Primary care is a U.S. term. That would be your GP outside of the U.S. And the AI powered doctor that you speak to on the phone has a 96% retention rate for the patients who are using it. So people use it, people like it, and people keep using it. That is a serious major jump. And also, there's AI legislation in front of Congress in the U.S. this year to allow machine learning software and AI agents to actually prescribe medications. So it's coming. So drop a comment in one of the chats if you kind of feel like AI is happening to you rather than happening with you. Um, it's a great big wild world at the moment. Um, Also, I've got some references for this. There's a 30-year AI researcher. So I guess most of his career he's been without much to do. He just published that healthcare administrators are nowhere near ready for this revolution. It is jump on the AI bandwagon, implement now, or else our competition will leave us behind. Don't understand it, doesn't matter. We're moving forward. So this isn't just a change. This is a complete transformation of healthcare that's happening right now. We're not talking about stuff in the future anymore. I'm talking about things that happened this week. Nobody knows how this is going to play out. They just don't. I don't know. I can make some theories. I can make some guesses, but I certainly don't know. That is what creates the opportunity. So when industries transform this quickly, early movers with the right expertise make huge generational, multi-generational wealth for themselves. We're entering that time for people like us to be able to make contributions into AI healthcare, into digital health that actually transforms our lives, our families' lives, and then care for multiple generations of patients to come. You have a clinical advantage. Everybody's talking about AI safety and patient consent and regulatory gaps. That means there's not a lot of rules, and companies who are working in the AI space are kind of taking their life in their hands, right? What if something goes wrong? What if somebody gets hurt? Are they going to be sued? How much is that going to be worth? Can they keep moving? They want some insurance against these kinds of problems. They want some foresight into what's going on. Guess what you have? You can tell the difference between routine clinical stuff and really interesting, highly complex, risky clinical stuff. That's you. The tech companies can build the AI, but they cannot understand why a 12-hour shift working nurse won't use it, and their revolutionary new tool falls into disuse and is used incorrectly and ends up with patient injuries, that sort of thing. This week, companies are out there advertising for clinical advisors. $2,000, $10,000 a month for advisory fees. This month, this week, AI oversight safety roles are exploding because there's not a lot of rules and people need some rules, so they have to be grounded in whatever exists. That's the clinical expertise that you already have. This week, virtual care platforms that need clinical oversight, clinical input, clinical specialists are absolutely exploding, and they're looking for people like us. So another important thing to remember about this is the timing factor. The experts are saying that healthcare administrators aren't ready. That gap is your opportunity. That's where you come in. So let's talk about some of the opportunities that are created in this chaos, because that's what it really is. It's chaos, and it's not going to settle down for years. The opportunities for clinical people like us are AI implementation consulting, hospitals scrambling around to find somebody to help them adopt AI responsibly, and digital health AI. Digital health contains lots of different avenues of work and everything else. AI is just the new shiny one. There's thousands and thousands of others. But normal people doing this work, doing this kind of consulting work, that's $100 to $200 an hour. And if you don't know in your head how to get from how much you're paid per hour to how much you make per year. Just multiply by two, and add 1,000 to it. So $100 an hour is $200,000 a year. That's the easy way to do it. Um, the government for AI safety and governance, this is a big area for us. This isn't, you never touch a patient. You actually don't even touch an AI system. You don't do anything technical or clinical. You just use your clinical brain to give, reasonable advice for AI safety and governance. The government is pushing innovation first, and companies are desperate to be, that first one to make the difference, to be the first mover in a marketplace, that sort of thing. And in order for them to do that, you are their backstop. You are the one that's got that clinical oversight that will keep them safe, keep them from doing something stupid that will cost them all of their gains. Some of the other work that's springing up, virtual care and clinical specialists. So the new models, like the one I mentioned earlier from HealthTap, where we've got a primary care or GP who is actually just an AI agent, right? They exist. They're just now starting to roll out into actual productive use, no longer in research mode or anything like that. And they need you. They need you to figure out why it didn't work for these 3 people, for these 30 people, for these 300 people, so they can make changes and make it better. They need to know if it makes a mistake, how to keep it from having that same mistake again. It's a big deal. And then finally, at a very basic level, every organization out there needs to train their staff on AI tools. If it's a healthcare organization, who better to train them than somebody who's already been living it, somebody with clinical expertise, and you will be able to scale that skill if you do it right. So in my blog this week, I also mentioned a respiratory therapist. She has one income stream that's worth about $85K per year, teaching others about AI monitoring systems. That income stream for her just keeps cranking over. She says, it makes money for me while I sleep. Well, that's a fantastic income stream. And then, unlike a regular clinical job where you have a job, you go in, you work, you get a salary, maybe you get a pension or some kind of like retirement savings or something like that later. In digital health, in healthcare AI, it's a completely open playing field. You can get income from multiple sources, and each one of them is unlimited. So if one goes down because something changed, create another one and work on scaling the ones that you have. They compound and multiply. They become references for one another. The problems with AI, and if you watched last week, I talked about ambient charting, right? So the computer's listening. In the future, the computer will be listening and watching, and then it does the documentation for you. Sounds great. But what if you're the patient? How much are you going to say knowing that there's a computer listening? How much are you going to divulge? How honest are you going to be? That sort of thing. There are some real problems with some of the new things that are being rolled out. And all of those problems are the opportunities for people like us. We know what the problems will be. Probably everything I just said about ambient charting made sense. The good part, the bad part, all the rest of it. But it doesn't make that sense for people outside of healthcare. You have to be clinical to think like that. And you may not realize that you have this superpower because you have it. Everybody you work with has it. It's just, common as pockets, right? No, not right. And most of us who have this kind of clinical judgment, we're afraid of all this techie stuff. We're like, I don't know that. It's not going to work for me, blah, 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 blah. And the truth is, it doesn't have to. The techie stuff is easy to use, and the most important thing in the room is your clinical expertise. One of the big problems mentioned this week was there's no key regulatory bodies. So if you follow a lot of healthcare stuff, the ONC in the US, it's not mentioned in Trump's new AI plan. It's not there at all. So companies don't have any idea what the rules are going to be because the ONC isn't even part of making the rules like they normally would be, like they did for meaningful use all those years ago. Um, People need clinical professionals to step in and say, this is routine and low risk. This is really interesting, very risky, and maybe we shouldn't even do it at all. Maybe our AI is not ready for it. They need people to say these words. Um, there's also huge problems with patient consent. But who better to design a consent process than somebody who's actually obtained written consent from thousands of other patients, right? You had to go in with this stupid little paper and actually put pen to paper in most places, and explain all of the risks, explain all of the benefits, try not to give them a bias and just give them an objective. Well, guess what they need to accomplish in AI health, in digital health? They need to do the same things, but the computers are going to miss out on the worried look that a patient has, on the change in their voice that says, "Wait, I'm scared." We need to be able to train them to pick up on that. We need to know what to do with it, and clinical people are the natural solution to this problem. Also, a lot of people are talking about, computational safety, that sort of thing, LLM safety. What about AI safety? Tech experts are worried about computational safety, but patient safety, these guys have no clue. They might be able to do something that's obvious and gross, but if you try to describe to them, why a patient's insulin needs to be changed after their steroids have been tapered back down, they're going to have no paradigm, no clue whatsoever. Throw a set of blood gases at them, no idea what's going on, no idea what you should do next. This is this is the time in digital health originally. It's very similar to when I transitioned and started working in digital health. The computers in the hospital were new. Nobody was really sure what the rules were. The rules kept changing. More and more people got interested in it. And the whole time I found my stock rising. I found my opportunities growing. And pretty soon I was traveling all over the US, being a big expert on this and that. And then I'd been everywhere in the US that I kind of cared to be. Everywhere but the Dakotas, really. And poof, I went international. And then I traveled all over most of the world. I haven't worked in South America. I haven't worked in Antarctica, but I've worked everywhere else. I definitely favored the developed world, by the way. Working in the developing world, well, if you plan on doing that, let's have a chat first, because there's some special considerations. AI tools have integration problems. Every new AI tool needs somebody who understands the real clinical workflows, not the theoretical ones, the way that they think things should work. They need to know what will really happen, what the real life consequences are. Life is different when you're working with a bunch of gerontology people than it is when you're working with pediatric people. And pediatric people are not just short adults. It's a completely different population. The systems do not have this nuanced understanding. To them, those big deals that I just listed are age differences. Whatever, doesn't make a difference. Anyway, at this point, I would say that there is a serious timing consideration for all of you watching on whichever channel you happen to be on right now. We're in a unique window where the demand is exploding, but the supply of qualified clinical professionals who have the gall to step into digital health is extremely limited. And let me say it again, because there was a bunch of people joined and they may have missed it. I had this idea at the beginning of my career that if I was going to work with computers in the hospital, I should get a degree in that. And I went and I got a master's in computer science. Useless. Absolutely useless. I've never used it. When I went into training, person sitting, to use a particular vendor software, the person sitting on my left had a communications degree. Person on my right had a history degree. I'm like, what the hell why did I get this difficult to get degree? And then when I actually started work, I didn't use it. I didn't use the degree at all. So focus on what's been my real competitive advantage over the past 25 years. The real life clinical experience, the real life clinical expertise. Don't be afraid of it. Stand in your power. Next, I would say when you do make a change and you're working in digital health, start your wealth building strategy here. Start with your, one consulting project, one advisory project, one retainership. Prove your value, get some references, and multiply. Increase your rates. Then you'll start to build some intergenerational wealth. Why am I talking about intergenerational wealth? Because I was born into intergenerational poverty. 15-year-old mother, run away from home, one room shack with a dirt floor. She worked at the factory during the day, no one to look after me. These kinds of things. I'm determined that I'm gonna be the inflection point in our family's history, and have people who follow in our family to not have those same kind of concerns about, like, where's my next meal coming from? How am I going to get food? Is the government going to renew that program that's been feeding us? Those kinds of things. Part of that strategy is also a geographic arbitrage opportunity. So, think if you're making, say, good money for a place like San Francisco, New York, any like major metropolitan area, and then you live out in the country, your income is way up here, your expenses are way down here. Invest the difference. Keep the difference. Keep it for yourself. That's a geographic arbitrage, and especially in this post-COVID world, COVID did a lot of bad things, hurt a lot of people, but we've gotten some lasting benefits from it. So the lasting benefits for me is I don't have to travel as much as I did. I was in 2 to 4 countries a week before COVID. After COVID, wow, do I not miss the travel? So remember, this week, the new AI primary care physician, the lack of regulation, all of these, that's stuff that's come out in a week. It's the environment in which there are multiple opportunities. It's an invitation to you to define your career in healthcare's new economy. You're not leaving healthcare, you're just moving to a different spot in the same big tent. You're probably thinking, I don't know enough about AI. What are you talking about, Ron? Yeah, you don't need to code. You don't need to understand the fundamentals of the LLMs and all the rest of that. You need to learn how to use some of these things. You can do that. You can do that because you know how to use Microsoft Word and Excel and those kind of things. It's no more complicated than that to use them. It's a lot more complicated to make a new one. That's not your job. Who cares? You don't have to be an expert on how the tool was made to be an expert on how to use the tool. And that's all people care about, especially when you're also clinical. When you're clinical and you say, don't use the tool this way, it's not safe, people say, thank you. And then you probably might be thinking, Rod, all of that Wild West talk, that sounds risky. And that's exactly what I was thinking at the beginning of my digital health career. It's exactly why I chose a path that was more secure, paid less, that sort of thing. But really, what's risky is building multiple income streams risky, or is depending on one employer risky in a industry that's completely transforming. I've got a roadmap about how to make a switch into digital health on my website. Website's down at the bottom of the screen, obviously. And you can make this change. I have individual clients. I work with them on a one-to-one basis to do all of the things for them. I teach them the AI tools. I teach them the latest, greatest things. And I teach them how digital health actually runs in the real marketplace, and, how much you should charge and all the rest of that kind of stuff, so people don't get taken advantage of. My real goal here is to increase my impact by taking people who are bedside clinical experts, putting my knowledge in their brain and having them start where I am, instead of taking so many years to get there the way that I did. No, I didn't have anybody to coach me. I didn't have, any direction, probably because there was no direction at that point. So remember, the healthcare AI, it doesn't have to happen to you. It can happen for you. It can happen to create opportunities for you that change your life, your family's life, and create a whole new reality for you. So direct message me on whichever platform. Go to my website. If you want to talk about the things that we talked about that I've covered today, send me something like gold mine or multiple income streams, something like that, and I'll know where you're starting from. And I'll be working on my own clinically focused AI education system and looking to roll that out later this year. So it'll be AI education, but for clinical people, which is to say, not people who know how to code, not people who want to learn how to code, not people who will ever code, but people who should be experts in the use of these tools. So with that, I'll open up the floor to questions. A lot of people kind of get run over in these sessions, and they don't have an actual question for me. It's fine. If you don't have a question now, but you think of one later, just DM me. If you have questions but you don't want to put it out in front of everybody, then that's fine. Just DM me. And I'll do my best to answer your questions. There's a million different ways to make money inside of healthcare. Digital health might be right for you, it might not. It's been really right for me. It's made me a real expert in it, and I'd love to help other clinical people get in the driver's seat to help this move forward. So I see lots of people have joined over there, and Layla Taluni, interested? Yeah, just DM me, Layla, and we'll go back and forth. We'll try to figure out if this is sort of the right thing for you, and if I'm the right person to help you. Maybe I am, maybe I'm not. But thanks, everyone. I've got dinner with my in-laws next. So whoever is here, say hi. Huh. All new YouTubing stuff. New stuff for me. Maybe I'll get better at using the chat interface next time. I do lives every week on Thursday. People on LinkedIn and YouTube. I do lives every Thursday. So just tune in about this same time, and I'll start advertising that. Not advertising. Putting out like a little short that says I'm going to go live on Thursday as sort of a reminder. And I'll see everyone next week. Get in touch if you want